So in 2018, WHO Intrapartum Care Recommendations were introduced, which were primarily to provide a positive childbirth experience to all women. This was introduced with the primary aim to have uniform recommendations for all women undergoing labor, be it at any kind of place, be it in any of the famine-stricken areas or war-stricken areas, to institutional deliveries, to private setups, to PHCs, CHCs, everywhere the WHO Intrapartum Care Recommendations have to be introduced and implemented to provide a positive childbirth experience to every woman undergoing labor. So the aim is to improve the overall quality of essential intrapartum care with the ultimate goal of improving maternal, fetal and newborn outcomes. So this was the ultimate goal, and what do we provide is a quality of essential intrapartum care has to be provided. So here in this 2018, the WHO introduced 26 new recommendations. There are already 30 existing recommendations which are present. This has to be implemented from labor onset through to the immediate postnatal period. And it is for healthy women and babies and to be implemented in any healthcare setting. Let us understand what were the guiding principles for the WHO intrapartum care model. It mentioned that the labor and childbirth should be individualized and woman-centered. No intervention should be implemented without a clear medical indication. Sometimes in our labor room practices, we have a habit of doing an early ARM to amniotic rupture, amniotomy to the patient to augment labor. Sometimes we feel that there is a tardy progress of labor and we want to augment by giving oxytocin and other interventions. But we should ask before doing any intervention in during labor whether it is medically indicated. How will you know where you have to intervene and where you have to implement a wait and watch policy? So this labor care guide will provide you a proper medical indication for your plan of action further. It is sometimes in some of the labor rooms, you have around 20-25 laboring patients. Like ours is a very heavy center. It's a government hospital where you have almost 18 to 20 or maybe even 25 laboring patients every time. Giving a handover or taking rounds for these patients becomes really difficult. So if you have one labor care guide which has all the 7 sections, you can just give the handover of each patient on just one paper. You need not turn the pages of all the file in and out here and there to look for investigations to see and understand what has been the progress of the patient. This was the reason why Partograph or the new generation Partograph was introduced, to provide a uniform pattern of care and also to avoid any unnecessary interventions and to inculcate respectful maternity care into the labor care guide. So what are the essential physical resources which are needed to implement this LCG? There has to be respectful labor and childcare birth. Emotional support from a companion of choice should be offered to the women. Effective communication by staff has to be ensured. You have to provide pain relief strategies to the women. Regular labor monitoring, documentation of events, and audit and feedback is a must in each labor room. Patient must be allowed oral fluid and food intake. You cannot restrict the woman by tying her throughout the NST machine. Mobility of labor and birth position of choice of the patient has to be offered. A pre-established referral plan should be there in place for any untoward incidences or complications that might occur during labor, and a continuity of care has to be maintained. So these are the essential physical resources which guide the LCG and implementing of a proper labor care guide for providing a positive childbirth experience to any woman that comes in labor. So only interventions that serve an immediate purpose and proven to be beneficial should be promoted. A clear objective that a positive childbirth experience for the woman, the newborn and her family should be at the forefront of labor and childbirth care at all times.